Hi, Travis from KDT, and what I want to talk about here today is a question I get asked very, very frequently by doctors is, well, you're out in practices all the time and we think your expertise. What do doctors say to get patients to accept care for decompression, especially when it's a cash service? So I thought about it long and hard, and even doing a lot of demonstrations, we're able to set up patients on the spot for care. No matter really where you're at. And so I wrote a patient script that pretty much takes you from start to finish on the engagement of the patient, the confrontational tolerance of asking for cash for this service. So I kind of laid it out. So how it goes is explain what it is and how it works, meaning spinal decompression to the patient. So they have to know what you're offering as a service. Explain how it can help their condition. Obviously, you can use a prompt like a dynamic disc design to show them, Mary, you have a disc herniation. When you go into flexion, see how your disc bulge protrudes into your nerve root. That's why your leg becomes numb, or you have that peripheralization. And when you go from seated to standing, you have pains. And so it's a really neat tool to make the patient visualize what their problem is. KDT has resources such as the virtual decompression animation videos. You can show the patient, on your basic Facebook page or your website that shows the interchange of fluid and shows how the table functions and how it works and why it might be beneficial for them. We talk about explaining their expectations of care, how long it might take to get results, how long the care plan might be. From day one, you got to explain pain versus pathology. So the pathology, for example, on a disc herniation, this research states that without any mechanical intervention, full healing of the disc by cicatrization, which is scar tissue formation, takes almost a complete year, like 362 days. But patients don't want to be disabled that long. So decompression can really get them, in most cases, back to work or daily activities in 2 or 3 months. But we tell them just because visit 8 your pain's gone doesn't mean you're fixed. So set them with the expectation of just because my pain or my symptoms are going away, I'm not necessarily completely fixed. Because why I say that is if you've sold a 20-visit regimen with rehabilitation and the patient has no pain in visit 5, which is not uncommon, you don't want them to think, I don't need any more and I need to be refunded. So explain the commitment to care is necessary for long-term results. So if you need 3 or 4 weeks of care, you can't bail out of care after 3 or 4 visits just because you're feeling better. And, I see chiropractors every day, and that's the struggle with even, adjusting. As soon as they feel better, they don't want to come back, or they just need their wellness. Explain only the absolute contraindications in the consult. You don't want to bore them to death with all the relative. So the big ones, like your pregnancy, your spinal hardware, and all that stuff. Build credibility with this therapy and the expertise of your field. Number one, the credibility comes from all the research on spinal traction decompression that's been published, that's been around for a long, long time, and utilized not only in chiropractic, but some of the PT places obviously do traction. Our decompression is a form of mechanical traction. It creates a much more effective result from the intermittent phases of the pumping. And that's what you explain to them. And the expertise is, you're knowledgeable, you're experienced, you're a KDT certified practitioner, so you can give them certainty of the result very quickly. And a couple last things, explain it's a cash service, it's not covered by insurance, and spinal decompression is not, and that you're offering a bargain, that there's practices in the area that charge 2 to 3 times as much as you charge. And then you give them a patient education brochure that it kind of explains the therapy to them. And you can say you can hit our Facebook page to learn more, or more importantly, send them to your website where they can see all the brochure information, the animation videos of the table, and really talk about how it's going to help them. So I'm sure that will greatly help you. And like I said, it's a proven method, and especially when you use objective data. So if you have an MRI that might be pertinent information or any imaging, that certainly helps as well. And any type of printed documentation of what's going on with them will help sell them more so than just rambling on at them at a bunch of big words. They don't know what it means. And one of our instructors mentioned this to me probably 3 or 4 years ago, and it made perfect sense to me. you know, husband and wife comes in and the husband has a problem and you say Dr. So-and-so tells them, you have this problem, X, Y, Z, and it's going to cost $3,000. And when they go home, say their spouse wasn't there, and they says, oh, Joe, so how'd it go with Dr. Such and Such today with your back pain? I don't know, he said a lot of things I didn't really understand, and he wanted to charge me $3,000. And spouse says, what do you mean? So, but if you have some sort of printed packet or some type of objective data or notes to take home that shows kind of what your problem is, what your treatment plan is, you're much better off and have a much higher success rate of actually closing that patient.